I'm Dr. John McClay, and I'm a pediatric ear, nose, and throat surgeon. I treat a lot of kids with chronic ear problems who end up needing tubes. Most of the time, kids do fine with ear tubes and don't have any problems. However, sometimes they'll have ear drainage. And when they have ear drainage, now there's kind of an area where we can use a topical medication rather than oral antibiotics. But if you're using ear drops to try to get and fight the infection, if that ear is filling up with ear drainage, there's no way to get the drop down there. So there's a technique that you can use to try to whisk out all the drainage from the ear so that you can put the drops in and they get to where they need to be. So it's just a whisking technique with a Kleenex. And I'm going to show that here with this cute little girl. Hi. She's kind of looking at me. So you first take a Kleenex and you use the corner of the Kleenex and make a little point. So you just kind of roll it up. And then once you take that Kleenex, you'll pull the ear back. And then you slide it in kind of in an anterior direction. Let's see. Let's turn her just a little bit. There you go, sweet. Let's set this one down. And when you pull it back, it kind of opens up the ear canal. You can see that sliding in pretty easy. And when you come out, it'll have a lot of goop on the end of it. And so I've previously done that with this one and got a lot of goop out. So when you do that several times, maybe 3 or 4 or 5 times before you put the drop in, then the drop's going to get to where it needs to be. And so even when you put the drop in, you want them to kind of lean over, and sometimes almost horizontal. You pull the ear back again, you'll put a couple of drops in, push down on the tragus, a few more drops in, have a little cotton ball ready, and slide that right in. And hopefully, again, they're kind of more lateral, laying down. Stay over for as long as you can, 4 or 5 minutes, and maybe even distract them with some kind of electronics or something. Hopefully after about a week, you'll resolve the infection and you won't need any oral antibiotics.